Hello, I'm Dr. Deborah Braboy with Anchored Hope Counseling. Welcome to our YouTube program, Hope Talks. We have some great content provided by our amazing counselors, and we hope that you find it helpful. Hi, I'm Dr. Deborah Braboy. I'm here today with Jason Amerson, one of our licensed professional counselors here at Anchored Hope Counseling. And we're just going to kind of pick up where he left off, talking about EMDR, eye movement desensitization and reprocessing.
That's good.
Yay!
Check you out.
And he's trained in that, and he uses that with a lot of his clients, and also a lot of us counselors here at the practice. We also have clients that we see and we do talk therapy with that we refer to Jason and Elisa. Does EMDR, and do we have a couple? Rahi and Linda are also certified in EMDR. So sometimes we will send clients to them that have trauma. You talked about the trauma, how it's like an emotional wound, and it doesn't have to be severe, like battle-worn trauma or sexual abuse necessarily. It can be anything that brings about emotional pain. But one of the things I wanted to kind of touch on is, I know when I've referred clients to you that you've done EMDR with, like, their initial hesitation is that they have to like unpack everything with you again.
Yeah.
And we've already gone over a lot of it in like my office. But that's not really the case. When they come see you, they don't necessarily tell you about their traumas. They're thinking it. So talk a little about that.
That is one of my favorite things about EMDR is you don't necessarily have to talk about it. When we go in and are doing a timeline of past traumatic memories, the way we do that is I tell them, I want you to, as long as you know what the memory is, I don't even have to know what it's about.
Sure.
And I tell them to imagine it's like a Netflix menu, and you know what the movie is. All I need to know is the title.
Okay.
Right? As long as you know what the movie is, it doesn't matter. And so when I went through EMDR therapy, I'll just use my own for an example. There was something that I remember from when I was about 4 or 5 years old.
Wow.
And I just called it balloon because there was a balloon in the room. And my therapist didn't know if I witnessed some kind of family fight and there was a balloon in my room, or if I was abused in some way and I remember seeing a balloon, or if there was a tornado and I saw a balloon stuck in a tree afterwards and it was weird, or they have no clue. But when the therapist came in the next session and said, okay, we're going to start processing this memory that you called balloon, I want you to close your eyes, I want you to pull up that memory, I knew exactly what to do, but I didn't even have to tell them about that.
Okay.
And that is one of the most difficult things that people find with talk therapy about trauma, especially people who have been through physical abuse or sexual abuse. That's very hard to go into detail about with somebody and talk about it. And especially when you're talking about referring people and they've already done some of that work, it's kind of like, I got to tell somebody else all this.
Right. That's the apprehension I've noticed.
Yes, and so when they find that out and see how it works, it usually puts people at ease. So that's one of my very favorite things about it. From a client perspective, when I did my own EMDR therapy, that was one of my favorite things about it is, okay, I don't have to necessarily tell. And the funny thing is as they make progress, I find that most people do end up talking about it some, even though they don't have to, because they're making progress and it's not as disturbing for them anymore.
Right.
And they start to open up and just talk about it.
Right.
And sometimes I go, you realize you don't have to tell me all that.
Right.
It's still working, and they go, oh, I kind of want to talk about it now.
Right.
And so it's neat. You can tell when somebody's starting to improve because they usually will open up. Not all the time, but a good majority of the time.
So do you find that you've had them create this timeline? Do you go through each trauma, or is it not necessary to address each trauma individually?
That is a great question. I'm glad you asked that. What we find is that, what I find most of the time is that we don't have to process each memory individually, because as they begin to process, they usually go through, there's usually one or two that are the major things, and then they kind of cover everything else in their own mind because we're having them, and this is kind of where I left off in the last video when I was talking with Brad, is when we start doing the process, we say, I want you to start on this memory, but I want you to just let your thoughts come and go wherever they want to. And every couple of minutes we stop the bilateral stimulation and all I ask is, what's the very last thing you thought of?
Okay.
And all I'm doing is making sure that those memories are moving. We don't want people stuck in one spot. We want your thoughts moving and flowing. And so they usually cover most of the stuff because it's all linked together. You know, it's all tied together. The spots in your mind where you're storing these negative thoughts and negative memories, it kind of leads from one thing to the next to the next. So a lot of times we do one or two of the memories and we've kind of covered everything else. Yeah.
So you've used the word neuroplasticity.
Okay, yes.
So tell us a little about what that means, what that is.
It's a big word, but a really basic concept.
Okay.
The concept of neuroplasticity is that just our brains are able to change, right? New neural networks are formed, and when I say neural networks, our brains have neurons. They have these little finger-like things that come off of them called dendrites. They have synapses at the end. One neuron, and we have billions and billions of neurons in our brain.
Okay.
All right. One of them fires to another one, and it's like a network.
Okay.
Right. And so those change, and trauma can change the way our brain has its neural networks formed.
Gotcha.
But the good news is, and this is something that a lot of people find hopeful, and we usually don't think this way, we tend to stay in our negative, like, oh, that trauma really changed me, or I've never been the same since whatever happened, right? The good news is, if those networks can change because of negativity, we can also induce a positive change and we can have new networks. And I always compare it to, I'm really big on analogies because I like to just break it down to where I can understand it.
Yeah, it's more understandable.
With EMDR, I always compare it to, like, if you imagine you had a Tesla and it's a self-driving car, and we start in this bad neighborhood, right? But we're just gonna let that car go wherever it wants to. So once we start the bilateral stimulation and we're telling you just let your thoughts go wherever they want to, we're allowing the neural networks in your brain to find new pathways.
Okay.
So at first, when you think about something that's negative, you tend to stay in that negative neighborhood. You may just go around the block over and over and over. But through the EMDR and the processing, we eventually, that car takes another turn over here, new neural network forming, a new pathway, a new route, and it will end up to something positive or neutral. And what we're doing is we're allowing the neural networks in your brain to say, like, okay, I have a new pathway. And used to, when I thought about that negative memory, it was all negative and it just happened like that. I thought negative, I felt negative. And now we're allowing that route to be formed to something positive. So even when I'm something that triggers a memory of something negative, I no longer feel negative because my brain has a route to go straight from that negative thing to something that's more neutral or positive. We've taken that car and we've learned how to get it to a new neighborhood.
So would EMDR be something that you would use for, say, somebody who grew up in a dysfunctional environment? And maybe their trauma is just not feeling safe in their family of origin. And even though they're an adult now, there's, you know, some trauma from that, I would say. Is EMDR something that would work in that kind of a situation too?
Most definitely.
Wow.
Most definitely.
Okay.
Like I said, I use it with about 70 to 80% of my clients. So most people that walk in the door going, my problem is not trauma, we find something. And we all have negative past experiences. Every single one of us. I mean, we don't live on this planet without going through some negative things.
Yeah.
And so it just helps. And we don't realize how much it affects us in how we react to everyday situations. So we may think, you know, my husband did this and that really upset me, but really your husband did that. Plus, that reminded you of all the other negative family interactions you've had in your entire life.
Exactly.
Your brain remembers that stuff, even on a subconscious level.
Well, there's that book, Our Body Keeps the Score.
Exactly.
So, So how many sessions of EMDR would you do with a client?
Okay. I get that question from clients all the time.
I bet
it's
you
like,
do.
How long is this going to take?
Right.
And it's strange because I can't answer that question until we get
So
started.
there's not a pat answer.
I've had some people that, and a lot of it depends on how much trauma is there. If somebody comes in and they've just had one major negative event, I've seen people, I had one that was referred to me from another therapist that just had one, they were very young and just had one really major life or death situation. And they had experienced a lot of negative symptoms, like were locking themselves in their house. Instead of going to college, we're just going to do all online classes because I don't want to leave anymore because I was in this really dangerous situation. And it really had affected their life. And it was like 4 sessions and they were discharged.
Wow.
But I've had other clients that I've done EMDR with for almost a year. And we're still working through things. And so it just depends on how much is there. And then just like people respond to medications differently, there are some people that it's like their brain just clicks with EMDR, and other people it's a slower process. And so we really can't make any guarantees until we get in and we start and see. But I have had, I've had several that were very quick successes. So that is possible, and that's always encouraging.
Sure.
That it could work very quickly for me.
Well, thank you for giving us a little bit of a peek into what EMDR looks like. If you have any questions about EMDR, you can call our offices here at Anchored Hope Counseling and get scheduled with Jason or one of our other therapists that's trained in EMDR. And we look forward to meeting you in person. Have a great day. Thank you for watching Hope Talks. We hope this information was beneficial for you. Please be sure to check out our other videos, and if you would please like the video and subscribe to our YouTube channel, we would really appreciate it. Thanks so much and have a blessed day.